Medico-legal aspects of abortions. What are the learning outcomes? Define criminal abortion. Describe the law pertaining to abortion in Sri Lanka. What are the methods used in criminal abortion and their possible complications and presentations? And describe the medico-legal issues in relation to alleged case of abortion. And also how about the medico-legal investigation and important steps. So now this is a flow chart. Now we are going to have medical definition and also legal definition. There is a little bit of difference there, and also what are the related laws which is embedded in Penal Code 303 to 307, and what do you mean by criminal versus therapeutic abortions, and what are the methods used, and in relation to these methods there may be complications and immediate complications, early and late, and then medico-legal investigation in a case of post-mortem and also in a clinical case. So we have to think about the 10-step procedure and also with other special facts as well. Discussing about general aspects, the term abortion can be interpreted both in medical and legal perspectives. The law varies among countries, as we all know. However, in relation to Sri Lankan law, performing an abortion is definitely illegal according to the base of the law of Sri Lanka, and it is only to save the life of the mother. And there are certain other indications which are applicable in other countries, such as congenital abnormalities, pregnancy after rape, incest, contraceptive failures, etc. Abortion is defined as the termination of pregnancy before fetal viability. Now the term fetal viability is important to be mentioned here, right? So before fetal viability, that means more or less 20 to 24 weeks. After viability, the fetus may survive outside the uterus. Therefore, in case of medical aspect, performing an abortion during the later periods of the pregnancy is not going to be termed as abortion. Instead, it is termed as induction of labor or termination of pregnancy. In Sri Lankan law, abortion is considered from day 1 of conception until natural labor, right? So now you can understand, according to the law of the country, abortion is considered from day 1 of the conception until the natural labor. However, as I have explained earlier, in relation to the medical terms, it is basically towards the latter part of the pregnancy, we usually use the terms of induction of labor or termination of pregnancy. Now you can understand there are certain differences of the words that we are going to use. Medical background in Sri Lanka. Now I am going to introduce certain terms which are very easy ones. Medical professionals primarily focus on the therapeutic aspects of pregnancy termination. The term miscarriage is usually used to describe a spontaneous pregnancy, whereas whenever someone is going to induce an abortion, it is termed induced abortion. Now the thing is, this kind of induced abortion could be in many forms, right? So it could be legal and also it could be illegal as well. When it counts as illegal, whenever an abortion is performed by a medical officer to save the life of the mother, it is a legal kind of abortion. And at the same time, the important word I am going to highlight is, it is a kind of therapeutic abortion. That's why the term therapeutic aspects words are used, right? So now it's clear to you, right? The medical practitioners cannot perform abortions independently and must act in accordance with existing legal provisions. However, in many legal contexts, doctors are permitted to perform abortions when it is necessary. That means to save the life of the mother. This is the rule of our country. However, a therapeutic abortion requires a proper clinical decision, typically made by consultant specialists, and where relevant, input from a consultant psychiatrist as well. Let's move on to legal background. Now, you understood that the term miscarriage is used when it is spontaneous, when it is induced, right? So, we termed it as induced abortions. Now, induced abortions could be illegal and also legal as well. All right. So, now and also one aspect that I have explained is towards the end of the term of the pregnancy, it is termed not as abortion as such, but it is the termination of pregnancy. Right. So, now what's the difference in relation to the legal background? In case of legal context, they use the term miscarriage instead of the term abortion, right through. So, the miscarriage is the expulsion of the products of the conception at any period of pregnancy before full term, all right, before full term. Now, when it comes to the legal background, now they use the term basically miscarriage, and also they consider from day 1 to the full term delivery or the spontaneous delivery, if something is going to do for the fetus, it is termed as a kind of abortion. Why is that? Right. Now, all these factors I have explained clearly. Now, to explain more towards the legal background, now pregnancy extends for a 40-week duration, as you know, right? So, there may be different occasions where abortion will occur. It could be towards the term and also very early in pregnancy, right? So, now you have to understand that now a single law can't cover each and everything. As a result, now you can understand there may be different sections under the abortion law. That's why now the abortion law is embedded in the penal code section 303 to 307. So, now in 307 they have emphasized about self-abortion. So, likewise you can understand the meaning behind it. And the consent of the mother and also self-induction or death of the mother and the POA, each and everything had been considered while formulating the law of abortion. Moving on to the description of the law of the country. The law is embedded in the Penal Code Ordinance number 2 of 1883 from section 303 to 307. Right. So, now you can see the sections here. 303 says causing miscarriage, right. So, the term they are going to use, the causing miscarriage by the mother herself is considered as an illegal act. So, if somebody is going to prove to have self-abortion, the person is going to get the punishment up to 3 years of imprisonment, and may or may not be, there will be a fine. If the fetus is quickened, so that means they have the law had recognized the viability, more viability of the fetus, and the punishment is 7 years, right. So, 303 is related to the self-abortions and the punishment is 3 years. If the mother is quickened, the punishment will go up to 7 years with fine. Moving on to the 304, here it is the maximum punishment, 20 years plus fine. So, what's the key component here? Without the consent of the mother. All right, if somebody is going to perform an abortion without the consent of the mother, the accused person or the wrongdoer will be punished up to 20 years of imprisonment with a fine. Now you can understand, now the law has recognized the concept of autonomy there. Now it is immaterial whether to mother is quickened or not, 20 years is applicable there. Moving on to the 305. Here if somebody is going to do the action of abortion, if mother dies, again the punishment is 20 years. Now this is a death, right? So with the fine, now the person is going to get the punishment 20-year imprisonment. Now you can understand here, now the death of the mother and also the concept of autonomy are equal, right? So equal amount of punishment, which is the maximum amount of imprisonment that the criminal law can offer, right? So now here, now you can understand under 305, if mother is going to die with the action of the miscarriage, right? Now further they have emphasized, it's immaterial whether the abortionist knowingly or unknowingly the mother dies, it's immaterial, the punishment will be the same. Otherwise the abortionist will tell, oh, I didn't think that this will go so severe like. Moving on to the 306, it says preventing live birth. Now you can understand that I have explained earlier, now pregnancy is a long period. Now with the time the fetus is well matured to have a live birth independently. So if somebody is going to have an abortion for such a mature child, that means to die just after the birth or to prevent born alive. In such case, the punishment is 10 years imprisonment, fine or both. That means the abortion act is to kill the baby just before the birth or to prevent being born alive, right? So now this is the section. Moving on to the 307, here death of a quick unborn child, right? So here it matters the component of quickening. If something has been performed onto the pregnant mother and pregnant mother dies, so in this case the offence will be moved up to the culpable homicide as mentioned here. And mother survives but baby is going to die, here now the person or the wrongdoer will get 10-year punishment plus fine, right? So now there are two possibilities under 307. If something had happened to the pregnant mother, this act is similar to the action of culpable homicide, that means a severe kind of attack. All right. So in this case, if mother dies, the wrongdoer will be punished under the law of culpable homicide, not under the abortion basically. If mother is going to survive but baby dies, in this case, this is the section that is applicable, and there will be a 10-year punishment along with the fine. Now here you can leisurely read one by one from section 303 to 307. It's not necessary to read or to remember everything with the legal words. If you can remember the basic idea as I have explained earlier, this is more than enough. Next, let's move on to the methods used in abortions, right? So it could be legal and illegal as well. The first method is medication-induced abortion, right? So now this method is used usually in early stages, timing basically up to 7 to 9 years, as it is used in early weeks of pregnancy. Procedures, right? So now you can understand mifepristone and misoprostol, all right? And what are the complications? Heavy bleeding, cramping, infection, and complete abortions. Then when the fetus is somewhat mature, that means 6 to 14 weeks, you are not going to remember each and every number of weeks, but when it is in early stages, still suction curettage or aspiration can be used. Here, what's the procedure? Somehow they are going to dilate the cervix and then apply a negative pressure to remove the contents from the uterus, and also scraping of the uterine wall. Complications obvious: infection, hemorrhage, uterine perforation, and even air embolism. Now you can understand, right? So now air embolism is a non-complication of abortions. Third method, dilatation and evacuation. Procedure commonly used after 12 weeks. The cervix is dilated and instruments are inserted to remove fetal tissues. So what are the complications? Obvious: cervical damage, uterine perforation, infection, bleeding, anything. Chemical interference. Here they tend to apply locally chemicals to the cervix, vagina, or up to the uterine wall. So with that, the fetus will be removed from the uterus. So what are the complications? Local and systemic toxicity due to absorption. So now this is a place where you have to know certain plant materials are used to have chemical interference to get the abortion done. Higginson's syringe, nowadays these methods are very old, however still we have to just theoretically describe. Here a fluid or air is injected to separate membranes of the placenta and along with the fetus from the uterine wall. Alright, so now with the syringe called Higginson's, they are going to insert fluid or air. So what are the complications then? Air and fluid embolism. So you have to know about these complications in relation to abortions. General violence method. So what's the method? They are going to apply physical trauma, blows to the lower abdomen in order to separate the fetus from the uterus, and vigorous exercises. Complications: physical injury to mother and fetus. And there may be an induction of labor as well during advanced pregnancy. So typically these are performed in hospital setting. Hysterectomy or cesarean delivery, again in advanced pregnancies, and also with this they are going to surgically remove the fetus. Okay, now it's very important to know about complications of abortions, right? So now here I have mentioned 3 stages of complications. So what are the stages? Immediate, early, and delayed. Right, so immediate means it's within seconds, no time at all, the lady is going to die. Examples: vagal inhibition. When somebody is going to dilate cervix, there may be spontaneous and very quick sudden death due to vagal inhibition. And also it could be a complication of anesthesia as well, and also it could be due to severe pain. Again, it's due to neurogenic shock. So these are the immediate methods. Moving on to the early, that means I have explained earlier, there may be cases of air embolism, amniotic fluid embolism in case of advanced pregnancies, fluid embolism, hemorrhage from tears of vaginal wall, cervix, and any maybe other parts of the vagina, right? And also with perforations, there may be early kinds of death due to hemorrhage. And moving on to the delayed or late deaths, these are the results that could have caused due to massive hemorrhage, shock, and there may be hypovolemia like DIC, renal failure, and also infections, and also due to septic instrumentation, again there may be infections, and also injuries to the genital tract, again with hemorrhage and infection, and also due to retained products, again there may be infective features and death, and pelvic inflammation due to perforations, and maybe abdominal cavity infections due to perforations and all, tetanus, gas gangrene, and finally it's not death, but it is infertility is also a fact that you have to understand. What is the role of a medical officer in a case of suspected criminal abortion? The first of all, as the intern house officer or any other doctor, you have to suspect. So this is the first thing that you have to have. If it's a case of self-abortion, but still it is illegal, section 303. So ideally, you have to inform it to the police to issue medico-legal examination form. And there may be obvious features of induced abortion which are illegal. In this case, again you have to inform the police definitely. There may be foreign bodies, severe injuries, etc. And also, if you are found to have a case of illegal abortion against the consent of the woman, definitely you have to inform the police for the medico-legal investigation. And another occasion where the mother's life is in danger, endangering life, again you have to inform the police. In this case, you have to take the dying declaration as well. Otherwise, we can't take much information from the dead person. And also, if you can find many cases of illegal abortions are admitted to a single hospital, and these cases are from the same area. So now it tells about that there is unsafe place of illegal abortion. So again you have to inform it to the police. And also, if a lady is going to die with a suspected case of criminal abortion, yes, definitely you have to have an inquest in here. And also it's your duty to collect all the evidence, very good history, marking of injuries, and also collection of fetal products, and have to have all kind of investigations, right? So now it's the role of the medical officer, right? So now these are the occasions that you have to inform to the police and to have inquest. And now at that point I am going to emphasize another important aspect as well, right? So now can we tell to the courts that this person was had been undergone for an illegal abortion without proving the signs of pregnancy? And also we have to tell about the POA as well. Now remember, in whether it is a clinical case or a post-mortem case, it's immaterial. Remember, as a medical officer, it's your duty to confirm the pregnancy first of all, right? So now this is the first thing that you have to have. So clinically you can take blood and also clinical examination, etc., etc. In case of a post-mortem, yes, you have to find features for pregnancy. And the second one is an abortion. An abortion has happened, all right? Otherwise we can't go for an allegation of abortion, right? And the third one, the abortion that had happened is not a spontaneous one, but it is illegally induced one. And then if it is illegally induced, what's the method and what are the injuries? And in case of death, right? So with this the induced abortion, only the person is going to die. With the complication of the induced abortion only, that the mother is going to die, right? So now this is the connection in between the induction of abortion and the death. Right, so medico-legal investigation of a death due to suspected case of criminal abortion. So what are the aims and objectives? See, we have described already. To establish a pregnancy and period of gestation, establish that an abortion has taken place, establish that the abortion is induced, because it could be spontaneous as well, and establish the method used. If the patient dies, determine the cause of death, establish that the death was directly related to the method used for the abortion, and also finding the possibility of having any threat to the life of the mother that necessitated an induced abortion. In this case, it's not illegal because it is considered as a case of therapeutic abortion. And finally, you have to help the police to identify the abortionist and also the place of abortion. Now we have arrived at an important step now. Now imagine you are the JMO and you are asked to perform a suspected case of criminal abortion, right? So now here you have to undergo for the 10-step procedure. All right, hope you all are familiar by the time now. 10-step procedure for medico-legal investigation, right, for a post-mortem. First of all, you have to take a detailed history. So now you can read each and everything leisurely. What are the important steps that you have to take, right? So I am not going to read each and everything. The second one, visit to the scene. That means the place where the abortion was performed. What's the purpose of visiting there? There may be trace notes as registers if it is a well-known place, and you can sometimes recover medicines, instruments used, and also there may be trace materials such as the shaved pubic hair, blood-stained clothing, and also sanitary towels, and also fetal parts as well. And sometimes the dead body itself could be there. So it's really important to visit the scene to collect certain medical evidence. What are the problems that you might encounter at the scene? The place is not known or not mentioned, and also if it is known, no evidence was there. They have cleaned the scene and thing. And also sometimes we are not requested to go to the police, requested to go to the scene. So in this case we can go on our own. And also the place is usually not going to reveal, right? So now there may be lots of problems at the scene as well, and sometimes the scene is washed, disturbed, changed. Right, as the third step of the medico-legal investigation, you have to identify the dead body with the help of two close relatives. Fourth step, preliminary procedure. You know, in medico-legal investigation for an autopsy, as per the preliminary procedures, you always have to take photographs and you all have to take X-rays. Now here it's applicable because X-rays may be actually speaking radiological findings, right? So there may be CT, not in our country definitely, right, to diagnose embolism and etc. And also you have to collect trace materials such as chemicals from the vaginal canal and uterus, foreign bodies and blood and pubic hair, etc. So now these are the steps that you have to perform for preliminary procedures. Clothing. You can identify the person with the clothing, and also there may be blood, and the amount of blood may be very important to tell about the cause of death and mechanism of death. And then as the sixth step, general external examination. So now you know, under external examination always there are two parts that you have to do. The first part is the general examination, where you do basic things such as height, weight, eye color, hypostasis, rygomatis, etc. etc. When it comes to general specific external examination, that means you are going to find very specific features for the pregnancy and features of abortion, features to formulate the cause of death and mechanism of death, right. So now you are going to have a look of such things such as signs of pregnancy, and examination of vulva is important to have, blood discharge, any smelly discharge, pus, and also signs of cause of death may be palo and septic features, signs of infections, etc. As per the internal examination, first of all you have to have generally exclude possible natural conditions. Now we tell that this lady dies due to the complications of criminal abortion, but we never know, the lady might die due to certain other natural conditions as well. So it's your duty and also to think about the possibility of spontaneous abortion as well. Alright, that means you have to think about fetal causes and other medical conditions, heart diseases. So each and every organ you have to examine. For internal examination, the first thing that you have to have or you have to write is, I am going to perform the internal examination with opening into the all three body cavities, and where necessary I am going to employ special dissection techniques. So in this case you always have to have pelvic dissection definitely, and also if it is applicable or it is suspicion to have air embolism and other kinds of complications, you have to do the special dissections to exclude about air embolism and also to exclude injuries, musculoskeletal dissection, etc. And what are the possible mechanisms of death? Hemorrhage due to traumatic injury, right? So hemorrhage is the mechanism. Septicemia, here the mechanism and causes of death could be multiple, right? So mechanism and cause here: hemorrhage due to traumatic injuries, septicemia due to infections, renal failure due to the induced abortion, air embolism due to the induced abortion, DIC due to the induced abortion, right? So we can list many possibilities as per the mechanisms of death and also for the cause of death. Right, as for the internal examination, yes, you have to examine each and every part, especially uterus, size, thickness, and evidence of pregnancy, placental tissue, and everything you have to have a look. That I am not going to discuss, but you have to read and understand, right? And also there may be genital injuries as well. What are the laboratory investigations that you have to have? As per the toxicology, you have to collect blood samples, urine samples, because there may be blood concentration of abortifacient and other chemicals, and maybe regarding the quantitative analysis of certain other medical drugs as well, and also samples to get any features of some other kind of diseases as well. And also you have to collect placenta, placental tissues, and also to diagnose pregnancy. Even histopathology is very important. And also you have to definitely take samples to connect the baby and the mother, and also at times rarely may be useful to connect the father as well. So you have to take samples for serology, or in other words for DNA as well. The 10th and last point of medico-legal investigation is the documentation. You have to document each and every important finding, every important positive and negative finding, pregnancy and period of gestation, evidence of abortion, evidence of induced abortion, and method used, and also the sequelae including mechanism and cause of death and other medico-legal issues as well. So now so far we have described about a post-mortem and 10-step procedure. How about a clinical case now? Right, so what do you think about a clinical case? Right? So for a clinical case, actually again we have to follow the steps of medico-legal investigation, but there are a kind of different steps as well, right? The first thing, you have to have the good authority, that means a proper authority, could be a magistrate order or under the MLEF as well, right. And the second step, you have to have a very good history. Third one, you have to have preliminary details such as date, time, place of examination and everything, the details of the police officer who is going to present the case, etc., etc. And then you can have the observations of the patient in pain, pale, septic, depressed, right. So many important aspects that you have to have. Now you have to have the consent of the person. This is very, very important, right. So you can't examine a person without the consent, right. So now the person should be more than 18 years of age, all right. So now here you have to take the written informed consent, ideally with a witness as well, right. If the person's age is less than 16, that means ideally you have to take the guardians or the parents' consent. I am not going to describe it in detail, all right. So however, consent matters. And also remember, here you have to have a chaperone as well, right. So now definitely you have to have a female chaperone while you are doing your examination, remember, right. So moving on to the consent again. Now the age of majority is 18 in Sri Lanka, so above 18, right. So you have to take the informed written, that means you have to explain everything. Now we are going to tell or to produce findings that we see during the examination and all to the police and courts whenever necessary. So likewise you have to express everything and only you have to take the consent. Now if the person is more than 18 but still she refuses giving consent, in this case you have to get the order of a magistrate as well, all right. And if the person is less than 18, that means you have to take the consent of the guardian, right. So now imagine if the girl's age is 18 and 16, what will happen now, all right. So here 16 and 17, all right. That means actually speaking, the girl is very mature, right. So she can give the consent though the legal age is not there. So in this case we take the concept of Gillick competence, all right. So please read it, and here you have to take the consent from both the parents and the relatives and also from the girl itself, right. So now less than 16, actually we usually consider that the person is not mature like, so in this case we have to take the consent of the guardian definitely and also the girl's consent as well, right. So now we have discussed about the chaperone and consent and everything and observations, right. And then now history we have taken, yes, everything is fine now. Again, what are the objectives? The most important thing, first of all, you have to establish a pregnancy, and then abortion has taken place. Abortion is spontaneous or induced. If it is induced, what's the method, and with the induced, what are the complications that she suffered, likewise. So you have to have certain objectives that to be proven step by step, otherwise it is not important during the court case. The first of all, we have to prove that the lady is pregnant, right. And then now 6th point, now we have to general examination. Now again, height, color and everything, yes, we know, general external examination. And now you can have examination of the lady. Here you have to have very good vaginal examination, injuries and other that means secretions, discharges, everything you have to mark there. And then you have to have investigation, that means sometimes you are going to collect blood, sometimes certain samples from the vagina and etc., right. So you can have everything there. And also you have to collect the clothing for blood stains, right. The next step is collection of clothing, right. So it's better to come higher up basically. However, you have to examine clothing and everything. all right, for blood stain and chemical smell and thing. And then anything else now you have to think, right? So specifically you have to mention about what we haven't done it in the post-mortem case is what? Referrals, right? So definitely you have to have referrals. So what are the referrals that you have to have here? Sometimes the lady is having what? Psychiatric illness. So in this case, psychiatrist. And there may be some medical problems as well, all right, and sexually transmitted diseases, right? So definitely you have to have certain referrals in case of clinical examination. And then sometimes you want to review the person, all right, and finally you have to document everything and fill the MLEF, and you have to decide whether the possibility of having a case of criminal abortion, right? So now these are the steps that you have to have in a clinical case, right? So with that, now I am going to ask a little question now. If somebody asks from you, what do you mean by a criminal abortion, what is your answer? That means if an abortion has taken place contravening the law of the country, it is termed a criminal abortion. Okay, if somebody is going to ask, what do you mean by a therapeutic abortion, what's your answer? That means according to the Sri Lankan law, to save the life of the mother, if somebody is going to perform an abortion, it is termed a therapeutic abortion, all right. So therapeutic abortion is legal in Sri Lanka. Any other abortion, everything is considered as illegal. Now induced abortion could be legal or illegal as well. Moving on to practice MCQs. Therapeutic abortion is also synonym for legal abortion. Yes, it's true, right? So we have described it. Laws related to abortion in Sri Lanka are mentioned in penal code. Yes, definitely it's true. Sometimes we tend to give criminal procedure code, evidence ordinance, all are incorrect. So it is embedded in the Penal Code Act. Neurogenic shock is an accepted cause of late death. No, it is an immediate death. Section 306 discusses a quickened fetus. What do you think? 306 discusses about a mature fetus, right? So to prevent baby being born alive or to deliver a baby as a dead body, right? So 306 usually discusses about not the quickening but the maturity of the baby, a mature baby. So it is incorrect. Ricinus communis or Vatainderu or Jatropha curcas L stem is used to induce abortions. It's correct. I have explained it earlier. They are going to insert Ricinus communis stem through the vagina up to the cervix. So now there are certain latex of these plants materials. So they are going to chemically react and to sometimes dilate the cervix to get the abortion done, right? So they are going to introduce it up to the uterus itself to get certain chemical reaction to get separate the fetus from the uterus, right? So now usually it is more likely to get Vatainderu or Jatropha carcass, but remember nowadays it is mentioned as Ricinus communis. So this is true. Abortion of a quickened fetus enhances the punishment. Yes, under 303 when in case of self abortion, if the mother is quickened, the punishment goes up to 7 years. Punishment is increased if an abortion is performed without consent. Yes, 20 years, up to 20 years. Yes, definitely. Maximum punishment. Self-induced abortion is not an offence in Sri Lanka. It's incorrect under the section 303 Penal Code. So, it's incorrect. Bleeding causes immediate death in an abortion. Again, it's incorrect. So, what are the 3 occasions where you get immediate causes? Neurogenic shock and vagal inhibition and anesthetic complications, right? So, immediate and early, right? So, this is a kind of early death. It takes some time to bleed to occur and also to cause shock. Punishment is increased if an abortion is performed without consent. Yes, the maximum punishment for criminal offences, 20-year imprisonment. Yes, correct. The presence of fetal parts in the mother's uterus confirms a criminal abortion. No, it's not. In case of incomplete abortion, you can say this. So, it is incorrect. Air embolism is a recognized complication. Yes, that's true. Amniotic fluid embolism is not in early abortions. That's again true, because to formulate amniotic fluid, it takes some time. An intern house officer is not expected to collect trace materials when admitting a suspected case of criminal abortion. No, it's your duty. So, as a result, it is incorrect, right? So, intern house officer should collect trace materials because you are the first encounter of the person. When a JMO performs an autopsy examination, he should first confirm pregnancy as per legal requirement, right? So, this is the first thing that he or she has to do. Otherwise, there won't be any allegation for having an illegal abortion. So, this is the first step. So, this is correct. Section 303 deals with self-induced abortion. Yes, correct. True. Section 305 and 307 deal with the death of a pregnant mother. Yes, true. Now, in 305, it describes of a death of a mother. That means with the action of abortion, the lady is going to die. So, here 20-year punishment. All right. And in 307, what happens? Now, some kind of action has happened which is very applicable as culpable homicide. That means very severe kind of action had happened onto the pregnant lady causing death. So, in this case also, death of a pregnant mother had been described in 307 as well. Here some kind of action, maybe kicking to the abdomen. Alright, so it is very severe kind of action. So, if mother is going to die, the person is going to, the wrongdoer or the assailant is going to have the punishment under the culpable homicide. If mother is going to survive but the baby dies, so in this case there may be 10-year punishment. Okay, so this is correct. Section 305 is not applicable when the abortionist does not know that his action is enough to cause death. No, it is not. Law itself explains it nicely, right? So, it is immaterial whether the abortionist knows or he does not know about the severity of the action that he or she is going to do. It's immaterial if with the action of abortion, if the mother dies, right, the person is going to act on 305. Even illegal abortions are performed without any complication. Yes, we know, right? So, there are lots of very advanced centers for abortions, but they are illegal definitely. Taking emergency contraceptive pills contravenes abortion law. No, it's incorrect. The reason is this is here emergency contraception, that means it's just to prevent the pregnancy. So, as a result, no, it's incorrect. A psychiatric disease itself would be enough to justify the therapeutic abortion if the condition is life-threatening. What do you think? Yes, this is really correct, right? So, threat to the life of the mother by continuing the pregnancy. So, severe depression, right? But definitely consultant psychiatrist should confirm the threat. So, this is correct. Incest is an indication for therapeutic abortion in Sri Lanka. No, it's incorrect, right? So, incest is not applicable in our law, but in certain other countries, yes. In law, until natural delivery occurs, if birth is induced to kill the baby, it is considered a case of abortion, right? It is true, right? So, we discussed about it. In a death due to suspected case of abortion, pelvic dissection is mandatory, definitely true.